Why did the government fail to act when Sage called on it to? And does the Secretary of State regret this delay?
She's trying again. The front bench opposite said this. On the 16th of March, I said to this House, and it was welcomed by the front bench opposite, today we are advising people against all unnecessary social contact with others and all...
Order! Don't shout at the Secretary of State. He's answering the question. Secretary of State.
Thank you very much. What I said on the 16th of March was today we are advising people against all unnecessary social contact with others and all unnecessary travel. That is when the lockdown truly started.
Alicia Kearns.
Thank you, Madam Deputy Speaker. I'm grateful to my right honourable friend for the actions he has taken, which have isolated the virus and protected nearby areas like mine in Rutland and Melton. On behalf of our neighbours in Oadby and Wixton, can my right honourable friend confirm these decisions are being made based on scientific data and that the city and county councils have a significant voice in the decision-making process?
Yes, absolutely. The decisions that we've taken in Leicester are based on the data, based on the best public health and scientific and clinical advice, and in consultation with the local leadership, and hence the decision to ask the advice of the local leaders in terms of the geography of coverage, and make sure that their insight, that we asked for their insight. And as I said in my seminar, I accepted those recommendations. As we've seen right across the country in local action, councils have got such an important role, just like we've seen in Blackburn and Darwin, where they took the initiative themselves to take the action that was needed. I pay tribute to what the council did there, because I hope it will stop that their council area getting into the position that Leicester got itself into.
Afzal Khan.
Thank you, Madam Deputy Speaker. It was shockingly clear at the PMQs this week that the Prime Minister had not read the report commissioned by his government on the worst-case scenario for a second spike of coronavirus that suggests upwards of 120,000 hospital deaths. Given the seriousness of this report, can the Secretary of State confirm that, unlike the Prime Minister, he has read it, and what steps he is taking to implement the recommendations of the report to prevent a catastrophic second spike of the virus?
The report was an incredibly important report in making sure that we look at we cast ahead and look at all of the challenges that face us ahead of us, but it took the assumption that there would be no action from government should the R go to 1.7. But it's the stated policy of the government not to allow that to happen. And so whilst it was a worst-case scenario based on a set of assumptions, we are constantly vigilant.
Dr. Luke Evans.
Thank you to the Secretary of State, and I appreciate his answer to several others' questions about the learning that he's done, because 10 days ago I asked him about information. For the people of Hinckley and Bosworth who live in Leicestershire, they want to know where the boundary is and what the implication is of any changes. Would he be kind enough to point out exactly where that boundary is, and for the people who are now out of lockdown, what that means in the measures they are taking, so there is a clear message that they can take home tonight?
Very happy to give that answer, which is very clear. For those who are in the city of Leicester and in Oadby and Wixton, then the measures that are set out, releasing on the 24th of July the closure of non-essential retail, releasing the closure of schools and childcare facilities, but keeping all of the other measures in place, that is the position. For those who are not in those two specific areas, they return to the same measures that the rest of the country is living with, except, of course, that we'll keep the higher vigilance, the higher testing and the communications in those areas. And the decisions on this geography was taken on the advice of local council leaders, I've seen, whilst I've been on my feet, that the Mayor of Leicester has made some comments around this. I did ask him if he wanted to put forward a different geography within the city of Leicester, and he declined to do so. But we work very hard, as closely as we can, with Leicester, and especially with the public health officials in Leicester, who are doing an absolutely valiant job in difficult circumstances.
Wes Streeting.
Thank you, Madam Deputy Speaker. On lessons learned, given the circumstances in Leicester, does the Secretary of State for Health agree that the government made a terrible mistake in cutting the Health and Safety Executive's budget by 48% and by instructing the HSE to reduce inspections into the textiles industry by a third?
I haven't seen those figures, but what I do know is that local councils have an incredibly important responsibilities in this space, and we will now act. We will now act to make sure that we tackle some of the challenges that we find, especially in Leicester.
Jane Hunt.
Thank you very much, Madam Deputy Speaker. I welcome the targeted new approach to business closures in the local lockdown area. However, the current lockdown has affected businesses both within the lockdown and outside it, the area, because people have decided not to open for fear of an unmanageable number of people coming to their establishment. Can the Secretary of State look to offer additional support for these businesses?
Well, the support that's available nationally to businesses, which is incredibly generous, is of course available to those outside the areas in question. I do understand the impact on businesses, both of course within Leicester, but also more broadly. And all I can say is that national support is available to all.
Rachel Maskell.
Thank you, Madam Deputy Speaker. Over the last few weeks, I've exposed the significant risks of COVID-19 in some of York care homes. These findings have wider application. Measures in the Coronavirus Act, poor decision-making and poor governance have undoubtedly led to increases in infection and mortality. And there are serious questions over the recording and reporting of deaths. Will he or one of his ministers urgently meet with me before the recess to discuss these tragic findings so lessons can be learnt and lives saved?
Very happy to ensure that the Social Care Minister meets the Honourable Lady as soon as possible.
Greg Clark.
Thank you, Madam Deputy Speaker. The Secretary of State is assiduous and energetic in making himself available to answer questions at all times, and I'm grateful that he's agreed to come before my committee next week so that we have longer than we would have had today given the statement. In March, we didn't have the testing capacity in place to cope with the volume of testing that was needed, and it took until May to get it. Sir Patrick Vallance has said to the Science and Technology Select Committee this afternoon that we don't currently have the testing capacity needed for the coming winter. So will the Secretary of State guarantee that it will be available long before then, and that we don't repeat one of the principal mistakes of the current pandemic?
I was heavily and personally involved in making sure that there was that rapid increase in testing capacity back then, and I'm absolutely determined to ensure that the testing that we need for this winter is available. We have plans in place to deliver it. Of course, that needs to be built. It isn't there now, but it will be built. Even if there are no breakthroughs on testing technology, which will make testing much easier to access, even if there are no breakthroughs, we have plans to ensure that the testing capacity that's necessary for winter will be available by winter.
Andrew Gwynn.
Thank you, and can I thank the Secretary of State for his statement. We know there are distinct areas of the country seeing local rises in cases, so can he explain what urgent steps the government are taking to increase testing in these areas? And with indulgence, as someone who's on week 17 of long COVID viral fatigue, can I also ask the Secretary of State what additional resources he's committing to NHS support services for those who are bluntly struggling to recover from the virus?
Deputy Speaker, I'm very sorry to hear that the Honourable Gentleman is suffering from post-viral fatigue. It is a very significant problem for a minority of people who had coronavirus. And my heart goes out to him because I know how debilitating it can be. I'm glad to say that we have brought in an NHS service and I'll make sure that he has access to that service, as should anybody who's suffering from the symptoms of the fatigue that comes to some. And also I put just under £10 million into research to make sure that we get the best possible treatment. It's an area that's very close to my heart.
Angus Brendan McNeill.
Thank you, Madam Deputy Speaker. Tapalev. At his statement on July the 7th, the Secretary of State agreed with me that 80% of positive cases are asymptomatic, and he would use capability for testing of asymptomatics. Now, unless we patrol for the virus today, it is Leicester, but tomorrow it will be somewhere else. And one serious gap for many communities are workers returning from, as merchant mariners or oil rig workers. Now, people are mostly routinely tested going on to oil rigs, but routinely are not tested coming off oil rigs. And I know of some oil rig workers who have tested positive, having taken tests for various reasons when they've come off. Now, I wonder if you will commit that returning mariners, and especially those coming off oil rigs, are tested, because we know that there's a danger and a gap we've got left open, that unchecked people may be unwitting asymptomatic coronavirus carriers. And can you do something to close this gap, please?
To look into that, we have a number of surveys to find out where are the highest risk groups by occupation, and to put in place asymptomatic testing to address that risk. Of course, many oil rig workers come ashore in Scotland. The UK testing capability is significant on the west coast of Scotland, in Inverness, in Aberdeen, and elsewhere, and I'd be very happy to work with my counterparts in the Scottish Government to test the hypothesis that he proposes.
Felicity Buchan.
Thank you, Madam Deputy Speaker. Will my right honourable friend update the House as to the steps Public Health England is taking to ensure that we are ready in the winter time if there is a second spike?
Madam Deputy Speaker, my honourable friend is quite right to ask about this, but it's not just Public Health England, it's right across the board taking steps in the NHS, taking steps in test and trace to grow capacity in contact tracing and the testing that our right honourable friend just asked about, making sure that, for instance, we need to know that the capacity is there right across the board. And Public Health England have their responsibilities, but so do we all.
Ilya.
Thank you, Madam Deputy Speaker. And I'm delighted that the Secretary of State for Health is so keen on data. My local CCG tells me that they're still not getting the right data to GPs. It's quite clunky, and they think, and they're right, I think, in saying that GPs can see comorbidities, so it's particularly important they get data about people who've been tested. And we have an outbreak in the north of my borough now, and we don't yet have the full postcode data. So we have the postcode data rather, but not the full address. This is isolated to households, and it will stop local lockdown if we can actually help get that very, very precise location. Surely the track and tracers are getting that data. Can they get that to local authorities so we can handle this locally?
I will personally ensure that all of the data that we have on her borough is made available to her borough, subject